Coming up next on the Jeff Crilley Show, we have a country that is sick. I mean, think about it. We're wired, we're tired, we're obese. We've got all kinds of problems. We're going to talk to a serial entrepreneur who has just the right prescription. That's just ahead.
Many are predicting that the worst is yet to come, which is unfortunate, said one person here. Until now, they've enjoyed the reputation of being the nation's icebox.
Watched a burglar in his home this morning by webcam.
As a journalist of over 25 years, stories are what make my world turn.
Reporting live from the Dallas newsroom tonight, Jeff Crilley, Fox 4 News.
But in 2008, I took the jump from my familiar life and started a PR firm from my home.
We're talking about anyone with a camcorder like the one I'm using becomes a television network.
We started slowly growing the company, and we now have over 100 clients, and we've branched into the world of live digital broadcasting. I now own 8 different TV studios and have a huge team, and the stories that I now get to share are sometimes the most important of my life. Life has a funny way of coming around full circle. This is the Jeff Crilley Show.
Well, if you've noticed during the COVID epidemic, we've heard a lot about shots and masks and social distancing. What we're not hearing about is prevention. To talk about that today, Pirnia, he is the founder of EverHealth, and you were talking about prevention before prevention was cool.
Yeah, I've been, I have a background as a biochemist, chemical engineer, and for many years I was in business, helping companies. And I started understanding the healthcare system we have, that it's more about managing disease and waiting for people to get disease. And unfortunately, it's a very expensive approach. What we should be looking at is this preventative model, where we look at imbalances and correct them before they become disease conditions. And that's what my passion is right now, is to get society onto this preventative approach to healthcare, and that's what we do at EverHealth.
So why aren't more people talking about it? Is there just not a lot of money in prevention? I mean, they don't build hospitals on well people, they build hospitals on sick people.
I mean, unfortunately, our healthcare system is based on this disease management format, and that's where the money is. We have a system that is supposed to make money, and the healthcare system makes a lot of money managing people's sickness. The other approach of prevention is not only less lucrative financially, but it's also, people need to go back to school and study this stuff and learn about the technologies, and that's something that's just not easily accessible to both practitioners and to society at large.
Yes, and you have a big conference coming up. Let's talk about that.
Yeah, we have the third Changing Life and Destiny Conference. It's a very unique event. It's a combination of specially trained functional medicine practitioners who will be there. We also have a lot of health and wellness professionals. But what's really exciting is we have an insurance company that is going to be presenting for corporate executives of self-funded, shared-funded companies. They're companies that pay for their employees. They're going to show these company executives how they have now embedded our programs into their insurance offerings that pays for the first time on lifestyle and wellness. A very paradigm shift to the traditional insurance model, which is let's pay for the drugs, pay for the surgery, and that's way past the point where you can really reverse and prevent. So it's a real sea change in the whole insurance industry of what we're doing.
Al, let me help make sure I understand that. So the insurance model would give you a discount if your employees were well.
Well, the insurance model will give you a discount if they're well, but what we want to do is get the employees to not become diseased and have a roadmap on how to stay well. Unfortunately, society is not educated on that roadmap of how to stay well, and it's ignored until we're diseased and then we're managed. So our objective is to get our practitioners working with these employees, working with their patients on a roadmap to stay well.
Let's talk more about corporate wellness, because that's been a buzzword for a generation or two now. But is it just lip service? I mean, a lot of companies have employee wellness programs, but you're saying it doesn't necessarily work.
No, see, the problem is that corporate wellness to date has been tests and information for employees on their test results, but they really are left to themselves to try and do something about it. And we know now from the studies and the reports that got published that that approach is not working. Literally $8 billion in corporate wellness is not really changing people's health profile. What is needed is 4 things. We need a specially trained practitioner who can give people a tailored action plan to address their issues. They are then also given accountability, they're given motivation, and the programs that can at least give them control over blood sugar and body composition. Elevated blood sugar, elevated body composition are the 2 main drivers of disease in America today. So at minimum, we need to address those issues, and that's what this conference is about, to show how we can make that happen in companies.
Well, it seems like a no-brainer because healthy employees are happy employees. They're not taking a lot of time off because of disease or illness.
Yeah.
This seems like a no-brainer. How come the message hasn't been embraced by corporate America earlier?
Well, the problem is that there are no companies going out and presenting this message because they didn't have the practitioners, they didn't have the programs, they didn't have the mechanism for this to be easily implemented in corporations with their employees.
Okay, so who needs to come to your conference?
Any practitioner who wants to get into the integrative functional space, because we're going to showcase some of the most amazing technologies for them to be able to implement and use in their practice. Anybody in the health and wellness space that wants to do more than what they're properly doing. A lot of corporate executives that are from self-funded or shared-funded companies, or anybody who is managing the benefits for a company, because they'll see some of the ways that we can help those employees stay well and prevent disease. And obviously any consumer that just wants to be more healthy. It's a very unique conference. We invite all that group to be a part of this event.
Yeah, and I applaud you because I think you're on the cutting edge of something where the young doctors and nurses that are getting into profession, they didn't get into the profession to take care of sick people. They really wanted to make people well, didn't they?
Yeah, I mean, I think the whole area of healthcare is there to keep people well, but our system has over the years just gradually moved to this disease model, partly because there's a lot of money in it, partly is because the way the educational system has been diverting their resources. And I think, especially with COVID, people are realizing that they need to start being proactive with their health. They need to start taking better care of themselves. That just that simple drug will solve my problem is not going to be the solution.
Absolutely. We're almost out of time, so final thoughts. What would you like to leave the audience with?
I would just like to say that our society needs to move to this preventative model. Half the population, the CDC says, will soon be diabetic. And the question for me is, well, who's going to take care of all these people who go blind, who have amputations, who have dialysis 3 times a week? Forget the money. Who's going to take care of them? Who's going to do all the work? We as a society need to start being proactive. And at minimum, people need to learn how to take control of blood sugar and body composition. And it's not a difficult thing to do.
Wow. Al Pirnia, he's the founder of EverHealth, and the website we're going to end with is changelifedestiny.com. Thank you so much for your wisdom and sharing it with us.
Thank you for inviting me.
You bet. That's it for now. We'll see you next time.